The AGA disclaimer: I do not have any financial interest in a product in my talk or an interest in any company offering grant monies for this continuing dental and medical education program. I work for a Mercury-Free dentist. What do I do on Monday? Yeah, the world is different than it was just a year ago. Everything seems smaller. People are worried about global warming. There's the whole stock thing, and even the kids don't know what's going on. Despite all of that, some things never change. Patients still need dental care. Consumers still want choices. And you are an above-average healthcare provider. Whether you're a business assistant, a dental assistant, chairside, hygienist, or the dentist, you're here, so you're above average. Academy. Show me the science. I have metal fillings in my teeth. My refrigerator magnets keep pulling me into the kitchen. That's why I can't lose weight. Patients have all kinds of ways of describing us to their friends. But science has changed dentistry. It's no longer filling a hole. It is no longer the pothole in the road that needs some asphalt thrown into it. We have sophisticated methods and alternative materials. So science has advanced film to digital images. Medicine, remember exploratory surgery? Remember your parents or grandparents having exploratory surgery? Imagine that nowadays instead of MRIs. Yeah, actually Krista did too. Eye surgery used to be radiokeratotomy and PK done with a blade. Imagine that. And now it's LASIK, laser surgery. Self-exams to mammography and thermography. And mercury to beautiful tooth-colored fillings. Just remember when you talk to your patient, we're not putting in a biologically compatible material. Only God can make a tooth. Your dentist is going to use the next best thing for you. So what's your motivation? Do you have amalgam in your mouth? Oh my. Why or why not? If you have amalgam in your mouth, you should actually sit down and talk to your dentist and go, you know what? I need to get these out. One of the questions that patients ask of your staff, so do you still have amalgams in your mouth? Why or why not? There are two philosophies here. One says, if it's not causing a problem, I'm not going to do anything about it. The other says, I'm health conscious, and you know what? I want them replaced. And if your doctor is very busy, ask if you can have a staff day. I'll tell you what, I'll assist for you, then you assist with me, and Doc donates his time, and we just change him, and we get it done. And he might say, okay, the first Friday of every month, we're just going to do staff day. Why or why not? You can't really talk to patients about changing the materials in their mouth if you don't think there is a problem. So I really hope that you all heard Dr. Griffin Cole this morning, and if you slept in and you didn't hear him, when your doctor brings home the DVD, please watch it. Because here are some interesting facts from the IAOMT, and these you can repeat to your patients. Many people, most people, will never tell you they have a mercury filling in their mouth. They have a silver filling. When I came out of hygiene school, I could polish up the ugliest amalgam sitting this close to somebody's mouth. 6-round burr, 8-round burr, little pumice, little greenstone, make those little puppies shine like the day they were put in. Guess what? I was inhaling. So are my patients. Because mercury is a powerful poison, and a large dental filling may contain about as much as an old-fashioned thermometer. They don't even sell those anymore. Temporal scanner, it's like a little ball on something no larger than a pen. Put it across, there you go, digital readout. No more mercury thermometers. Tell that to your patients. Mercury vaporizes easily at room temperature. In this state, odorless, colorless, tasteless. Inhaled mercury is rapidly absorbed into the bloodstream. Think about basic science. Oxygen comes into your lungs. What happens? Oh, that's right, it gets pumped from the heart through the little cilia. Oxygen is picked up. You're exhaling out the carbon dioxide, but there is a barrier, and Mercury does cross, and in the brain it crosses the blood-brain barrier. Oh, not good. As you inhale, it's absorbed. As you swallow, it is swallowed with it. World Health Organization has concluded that dental fillings contribute more mercury to a person's body than all other sources combined. IAOMT, hard science. And published research, not a trade journal saying there's not a problem, but real research demonstrates mercury is more toxic than lead, cadmium, and arsenic. Would anyone paint their bedroom with lead-based paint anymore and sleep in it at night? Why would you put amalgam into someone else's mouth? There's a cumulative effect. But people don't like to take orders. They like to take part. So with your patients, this is sometimes called co-discovery. Discovering that they're not silver. There's a silver component. That's why they're silver colored. One of the reasons why. But you need to communicate only the science. It's getting near Easter time. So if you have a website, and I hope you all do, you should have a link to the IAOMT. Let them get that information themselves. When they ask a lot of questions, refer them to the IAOMT website. Frankly say, there is so much science out there, because some people will come and go, you know, my old dentist said there wasn't a problem. Yeah, there is. You know what? There are so many articles. I'm not a dentist. I'm not a researcher. But if you go to this website, you can look up all the information you want, because there is real science, not just somebody's opinion. So you need to talk to your patients so that they listen. When you look at them in the eye, and we talked earlier, if you were in the last session, about body language, or NLP, neuro-linguistic programming. It's what you mirror to the patient and the way you project yourself. You look at them and you be very honest. It took a while for your teeth to get this way. It'll take time and some work on your part, but we've had great success helping people with similar problems. I have not said we are going to cure anybody's ailment. Mercury does not create a disease. That is true. Disease entities create diseases. But Mercury is a contributor in a number of situations. We've had great success helping others with similar problems. Use words they can understand. It's like taking your car in because it's making a funny noise. We can't tell what you need until you come in. People understand that. And give them choices. We can see you at 3 o'clock today or tomorrow at 9:30, which is better for you. You don't say, when would you like to come in? One of my favorite things is when I call, we have a particular lab that we deal with, and every month I put that bill on my charge card. And the young woman on the other end of the phone always says, how much would you like to pay? Well, I'd like to pay $20. I owe you $8,000, and I don't think your boss is going to let me get away with $20. And then she'll laugh. So I'm now training her to say, your bill for the month of February was $8,320. Will that be Visa or MasterCard? And that's the way you present it to your patients. Do you ever come out of the grocery store with the cashier saying, would you like to pay? Oh, heck no. I don't want to pay. They say, it's $128.27. And then they shut up and they look at you. Cash, check, or charge card. Oh my. You work for a dentist. Is there stress in your life? Yeah. My dentist is wonderful. Our office is wonderful. Every now and then I go home and have a glass of wine. What causes stress in a dental office? Number one cause. Number one, any practice management consultant will tell you running behind. Number two, no-shows and cancellations. And number three is finances. Look at this one carefully. My office is so busy. I don't know why Doc keeps saying that we need more money. You can't pay the bills. Is it the result of poor payment plans? Are you having your own personal financial problems that make it difficult to ask for payment? Oftentimes, the person at the desk does not feel comfortable enough saying, the bill for today is $1,200 Your insurance is picking up half of that. Oh, lucky you, $600. But the other half is your responsibility. Don't say anything else. Don't shy away from it. I'm so sorry, but it's like $1,200 today, and your part's going to be $600. Fee for today's service was $1,200 as we went through with your treatment plan. Lucky for you, your insurance is picking up half of that. Your balance is only $600. Cash, check, or charge. That's it. Wait for them. Let's take these one at a time. Only Caruso had everything done by Friday. Why do we run behind? It is improper or incomplete scheduling on some procedures or most. Do you find that you run behind every time your doctor does a crown prep? Do you find that you run behind every time you've got children in? Or do you just generally run behind? Start taking your day sheet, your schedule, and putting little check marks on what time you completed. Or check mark if you completed within 10 minutes, or write down the time if you were late. So you can start analyzing this. Or is it constant interruptions? The staff, the phone calls, the internet. Some doctors are now so internet savvy that they got to run back and check their emails or check their stock prices. You know what? Stock prices are going to go up. Stock prices are going to go down. It's not going to change for Mrs. Smith, who's sitting in the chair, who took a half day off work to come to your practice. They really don't care what else is going on in your life. So, yeah. Yeah, go ahead, cancel. We don't even write it down anymore. Do you have those patients that are chronically 15 minutes late? So I always tell them that their appointment is 20 minutes earlier than it is, and then one day they show up at the time that you told them? Yeah. In that case, there's got to be some little conversation like, oh my gosh, we had to put an emergency person in ahead of you, so today it's just going to be a little bit later. They can understand emergencies. Prepare the need ahead of time. Why does the patient need to have a crown prep? Did you take digital x-rays? Anybody here not digital? Yay. All right. Digital x-rays up on the screen. When the patient is in the chair, laying there, waiting for the doctor's exam, that little teeny, looks like an incipiency, suddenly looks like the Grand Canyon. Did you use an intraoral camera? Because that little thing that you can kind of feel suddenly looks like the Grand Canyon. Have the pictures up there while you're discussing whatever else you're doing. Patient understands need. But don't worry, Mrs. Smith. Hey, we'll fix that one for you. Confirm their exclusive reservation by phone 2 days ahead. If they're a Gen X or Gen Y, if they're a 20-something, 30-something, even a teenager, would you like me to confirm that by text message or phone call? You know what? In my world, I'd really much rather get a text nowadays. It's an exclusive reservation. It's not an appointment to see the dentist. It's an exclusive reservation. People look forward to reservations. Finances. Insufficient revenue. Okay. Anybody here blueprinting? Raise your hand if you're blueprinting. That's what we're going to talk about then. Block scheduling and blueprinting. It's a way to efficiently use your time in the office. We'll get back to that one in just a minute. Do you work enough production hours? What % are you collecting? You're an in-network office over here. If you are a cash basis office, you should be collecting 97%. If you're in one of the networks, you should be collecting 93%. That's just kind of the norm. And how old are your outstanding balances? Because if you're sending collection letters all the time, you don't have an efficient collection system. Let's take these one at a time. Block scheduling will allow your doctor or hygienist to see certain types of treatment certain times of day. So you block these off. The A is for anesthetic time. Most patients will tell you they're far more comfortable when they are profoundly numb. You don't want to have your doctor give the anesthetic, pick up the handpiece, and go right at number 29's DO. How about give the anesthetic? Mrs. Smith, I'm going to let that work for a little bit. I'll be right back. Lori here is going to rinse out your mouth for you, and I'll see you in a few minutes. Let them get numb. Give that 10 minutes of anesthetic time. 2 X's mean that's 20 minutes of doctor time. 10-minute scheduling is really much more efficient than 15-minute scheduling. So if you're not sure how long it takes, start timing. Start asking your assistant in the room, time out how long it is from when doctor comes in the room till when he's done with his portion. Now, the rest of that crown prep time is the assistant. Now, it depends on your state licensing, whether or not your doctor or your assistant packs the cord. It depends on your state licensing, whether your doctor or your assistant takes the impressions. In Michigan, we can pack cord, and we can take impressions. And we can make the temporaries, and we can fit them in the mouth. Doctor comes in and checks them, and that's like a 1-minute check, because they can adjust a temporary outside the mouth. Put it back in the mouth, check again. So that part is going to depend on your state licensing. But count the amount of time that your doctor spends with that patient, what the time is that the assistant spends with the patient. Doctor's time is X, assistant time is an arrow. All this extra arrow time can be doctor in another room, seeing another patient. We do consultations. If your consultations on average are a half an hour, it's a complimentary consultation after a new patient appointment or after a substantially phenomenal event in someone's life. An accident, perio disease. They haven't been in 3-4 years. They've lost their job. They've been under a lot of stress. Rampant perio. We'll bring them back for another consultation to explain it if we don't have time right then. Normally we don't. And then emergency time. Everyday emergency time. The arrow is the assistant. Bring that patient in, get the x-ray, find out what's wrong. Time for anesthetic, time to do something. Which, by the way, an emergency is just that. It's pain now. You're going to want to get them in that day if they can't the next, and you're going to want to get them out of pain. Well, can you fix it today? You know, it's kind of like calling your mechanic and saying, my car makes a funny noise. How long will it take? What will it cost? All I can tell you is if it's simple, doctor's going to take care of it today. If it's something more complex, he's going to get you comfortable, and he'll tell you what else it's going to take. That's all they need to know on the phone. Not he's going to get you out of pain. He's going to make you comfortable. Don't use the pain word, that stays in their brain. Get you comfortable. Okay, blueprint enables them to be in 2 places at once. Can't read that one. Looks like there'll be a slight change in the treatment plan. Yeah. Now, blueprint works if you have at least 2 operatories and they're fully outfitted and you have staff. You choose your time minutes, analyze your procedures, and then you write a master blueprint based on the needs of your practice. So once you've blueprinted and you say that regular restorations take the doctor 20 minutes per tooth, doing multiple teeth at the same time, add an additional unit on. Once you do this, feel free to tweak it. If he's constantly running behind, well, then you need to add an extra unit of time. If he's constantly walking out of the room going, where do I go next? I got time, maybe I'll go check the internet, then shorten him down a little. Now, 2 big things. Does the doctor have to wait for staff to return to the treatment room? If you are short-staffed or slow-staffed, both are a problem. In some offices, there is the main assistant and then her assistant, the one who scrubs the instruments down and takes down the room. You really need to have fully trained assistants. In order for this to work and for the doctor to be most productive, you need 2 fully trained assistants and 2 fully prepared operatories, because one will be taking their patient up to the desk, then cleaning down their room, while the other one is in with the doctor. If he's got to wait for the staff because the good assistant is now explaining to Mrs. Smith, who asked a question about her child as well, he can't be working on Mrs. Jones, who's in operative 2. And the other one, does the staff have to wait for the doctor to return to the treatment room? You have hygiene patients. He has to check the hygiene patients. If suddenly your schedule is so tight that he doesn't have time or he runs behind because he's back in hygiene and he's explaining too much, if something's complicated, it's just fine, tell this to your doctor, to say, and if you're a hygienist especially, Doc, I've told Mrs. Smith there's a lot of stuff going on in her mouth. We've got the x-rays. I wasn't sure if you're going to want some study models, but it's probably better, I told her it's probably a better idea if she comes back after you have a chance to analyze everything and have a complimentary consultation. So assuming you have 2 operatives, fully staffed, patient Smith is getting crown prep while Mr. Jones comes in for the DO on 29. 2 surface, 2 units of doctor time. There's also time here to bring in a toothache on the lower right. Once this assistant's taken down the room, brings in Mr. Brown, takes the x-ray, doc pops in, gives anesthetic, and does the provided service. Next patient's coming in to get some crowns cemented. We've got a consultation, and we still have the emergency time at 9:20. Which, by the way, if it's a new patient emergency, the time is 9:20. You ask them to come in at 9 o'clock. You don't have time to mail out the new patient health histories. And you do need to get the health history. So, in most cases, this is what you're going to do. Multiple teeth, you're going to add an extra A time unless it's a different quadrant. And then you're going to tweak how it works for you. If your doctor is using a new material or a new process, you're going to need to tweak it again. Now, we are doing CERECs, so right now we've changed all of this. We do some crown bridge work that will still go out to a lab, but with our CEREC we have a new blueprint for that as well. But blueprint every step that you need to do for all the services that you normally do. Don't do everything in the code book because you can't. Do it for your normal procedures. Perio-endo, oral surgery, TMJs, bleaching trays. Again, depending upon your state's abilities, what your licensing requirements are, cosmetic bleaching trays may be done by assistants when doctor's in another room doing someone else. Hygiene appointments, we do the same thing. Blueprint out their time. Adult recare, child recare. And I hope none of you call it recall anymore, because my car gets recalled by GM, but our patients come in for recare. Hygiene schedule, same type of thing. Periodic exam, Pro P4 bite wings. Patient hunt is longer because we're taking the Panorex today. Our sealants, a periodontal maintenance. Oh, that's right, doc, it's a peri-M. Doc will not need to do an exam on that patient. If you have an operative patient who's going to take a half day of services, suppose you have a cosmetic case, and you have something like maybe children back to back on the right schedule, think about how you're scheduling this. Is he going to have time to leave and keep checking all these other operatives? Or all the other hygiene patients in between his operative? Make sure that you're scheduling so that there's time for a doctor to do his operative as well as hygiene to do theirs. And that, by the way, a hygiene patient deserves every bit of attention as the operative patients. When doc fails to check the hygiene patients timely, suddenly they're second-class citizens in your office. So you need to have some type of a mechanism to let the doctor know. In some offices they have a light system. In some offices they have a routing sheet or something that comes back to the operatory that has the hygienist initials if you have more than one. Some means for the doctor to know without tapping him on the shoulder while he has a handpiece in someone else's mouth. I like this. I'm a former hygienist, but our hygienists are in 11, 12, or 13, 14. Perio screening. Anybody doing perio screening? Yeah. Okay. Difference between perio screening and perio exam is like getting a mammography in just one breast. I did perio screening for years and years and years until every now and then you'd find, they've been coming out fine in screening, but now we're noticing other areas of their mouth. You can't screen. You got to do the full thing. You got to do the full exam. Train your patients. Tell your patients, this is not just, it's not just a clean, so I'm going to cancel it. Well, Mrs. Smith, you're kind of at the age. Yeah. We do periodontal exams. You don't, if you're on the phone and Mrs. Smith is canceling, or you're listening to your voice messages from the night before and Mrs. Smith is canceling, it's just the clean, so I'll call you back to reschedule it. Pull the chart. She's got some 5s and 6s in her lower left quadrant. So you're going to get on the phone, you're going to go, Mrs. Smith, Debbie, I just told Debbie that you're not going to be in tomorrow, and she asked me to call you personally. We're very concerned because you had an active disease process, you had periodontal disease on your lower right side, and we're very concerned, and we're trying to help you work with this. So please call me back. We need to reschedule that for you. Or if you've got her one-on-one on the phone. Once you have established a need, it's not just a cleaning. You're not just like everybody else. And then the outstanding balances. Do you have a written agreement? On the end of whatever health form you're using, or new patient form, you should have a payment arrangement or a financial agreement. They're either going to pay as they go, or they're going to be on a payment plan. As soon as you present treatment, so you understand it's going to take 6 visits over about a 4-month period of time to get this taken care of. Total cost of treatment is $5,400. You have a $1,000 max with your insurance, and we will maximize all of that for you. Your portion is going to be $4,400. Now, these are your options for payment. Do payment at time of service. We do a short-term payment plan in the office up to 90 days. But the best thing that we do is care credit. It enables you to extend payment over time that's comfortable for you. And I don't know if you have Art Van furniture here, but we relate a lot to the Art Van philosophy. You get 12 months interest-free, but on day 365, it's going to back you up to day 1 with interest. So for a lot of people, it makes no sense to pay it off 8, 9, 10 months. Their tax returns coming back. However, it's comfortable for them, and it doesn't affect their Visa or MasterCard balances. Make sure you get it in writing. Present it matter-of-factly, just like the clerk at the grocery store. And then, every now and then, when all else fails, if someone's losing their home, if they lost their job, are you really going to hound them for a $300 dental bill and expect to get paid? Pick a patient or two, once a month at a staff meeting. Your business staff knows who they are, or your assistants might know. And say, you know what, Doc? Mrs. Smith's been coming here for 12 years. Her husband lost his job. She told me she had to cancel that appointment. Let's gift them. Don't write them a business letter. Go to Target, get a basic little card, so it looks like a birthday card in the mail, hand address it, and on the inside, we're sorry you're going through some tough times. Don't worry about your dental bill. We've zeroed it out. And by the way, for the next year, come in for your checkups. We're going to take care of your needs while they're small. Don't worry, your husband's going to make it through this. You're still a patient in this practice. That make you feel kind of nice? Do you know what advertising dollars cannot buy that you just did? You've lifted someone. You can do this. It's much better to do this than spend $300 in an ad in the Yellow Pages. Now let's get back to common sense business, because in the end, if you can't pay the bills, you're going to be out of business. Yeah, it's a shaky economy. I'm from Michigan, 12% unemployment. Last year was 8 point something. We've been doing this for several years, so if it's just affecting your neighborhood, we've made it through. We will continue to make it through. Told the last group or group this morning, anybody remember Iran-Contra? The Ayatollah Khomeini looked like the world was going to come to an end in the 80s. We're still here. Think about September 11th, 2001. We thought the world was coming to an end. We're still here. We're going to be here. Don't bother about what happens in the newspaper. Stuff will happen. Stuff always happens. I've been doing this for 39 years, good times and bad. People need health care. Care. And we'll be there. And you'll do it. And you'll get through it. What if you brought in just $1 more every minute you worked? If you schedule by blueprinting, you'll be able to do that. There are still a lot of offices out there. My first hygiene office, adults were an hour and children were a half hour, whether they needed it or not. I worked near a factory, so the men that I saw had calculus so very thick and stains so very bad, you couldn't really get it done in an hour. So you do the lower right or the lower left, but you leave something on their lingual anteriors so that they go, There are holes here. No, that's not a hole. That's the space in between your teeth. But you haven't been in a while. It's going to take another visit to get you back. That's the old style of doing it. The modern style is doctor does the exam, explains what needs to be done, brings the patient back for the hygiene. And scheduling effectively will get you there. Balanced budget. Now, I don't know if you're the ones that help write the checks in the office or not, but this is just basic sense. It works in your home, it works in a school, it works in a business, and it works in dentistry. Were you able to do what you needed to do with the revenue you brought in last year? You should have a production goal, just like the captain of a ship. You've got to sail somewhere. And if not, you're going to have to carefully increase the fees, the hours, the days worked. Let's do this in real numbers. How to figure out your goal for your production. It's an easy way to do it. This is called Sherry's method. Last year, you look at your expenses, and you can write this down. Your doctor can do it, or it's in your handouts if you didn't download them yet. Let's say last year doctor said all the bills added up to $750,000. He was able to pay that, but he carried $20,000 in credit card debt in order to do that. So this year, you want to get rid of that credit card debt. Oh, and by the way, Doc is at the IAOMT meeting, and he just found $30,000 worth of new equipment that he wants to add. Yeah, that's a whole heck of a lot of money. That now comes up to anticipated expenses for this calendar year or fiscal year of $800,000. Last year, you worked 190 days. Take your calendar, just count them up, month by month. That means that you would need to bring in $4,210. However, we know that we do not collect 100%. Add an extra 10% per day, work in 190 days, you need $4,631. That's what you have to do. That's the brass tacks, bottom line, how you do it. Or what you need to do. How you do it is by having data. What do we produce each day? What was that goal, that 4631? What did we actually bring in? How many patients did the doctor see? Hygiene is really, and again, this is going to depend upon your own state, hygiene is generally 25% of the bulk. Now, in some states it's as low as 20, in some states it's about 27, 28%. Number of new patients and patients to call following treatment. Nicest thing a doctor can do that doesn't cost a penny on his way home from work. Hey, Mrs. Smith, this is Dr. Jones. This is the first time you ever had a crown done. This is the first time you ever had a root canal done. Just checking to see how you're doing. This is my cell phone number. He's leaving a message. She's at work. Just calling to see how you're doing. You can call me back at my cell phone if you have any questions or problems. You can call me back at my home. My number is, and I'll see you soon. Bye. Free. Absolutely free. Nobody does that anymore. Personal finances. I need to eat 3 meals a day or I'm going to be a really grouchy person. I don't need a $200 pair of shoes, but they're so cute. Money is the #1 item that most couples argue about, including dentists, including dental staff, including your patients. So don't ever expect to get a raise until you've helped your practice grow. You should have a number production. Your staff should know what that daily production is. And once a month, there should be a staff meeting that says we made it or we didn't. Last quarter, 2008, we missed it by dollars, but we missed it 3 months in a row. Broke my heart, broke their heart. This quarter, even after my husband had hip surgery, we've made it. Not by leaps and bounds, but we made it. That's a celebration. We made the goal. In our practice, something that you can take home to your practice is every other year we do a really cool continuing ed. In February, 13 months ago, we went on a cruise. 2 years before that, I'm going to get these in the wrong order. We've been to Vegas, we've been to San Diego, we've been to New York, we've been to Toronto, we've been to Northern Michigan, we've been on a cruise, we've been to Clearwater, Florida. I'm missing a whole bunch of them. If you plan this, if your doctor says to take all of you to pay for the course, to pay for the hotel, to pay for the airfare. You know, I'm looking at another $10,000. I'm looking at $12,000. Okay, Doc. If we plan to do this in 2 years, that's $500 more a month. That's $125 more a week. How many days do you work a week? Break it down. How much more a day? Can you do this? Sure you can. Do you want a 10% raise? Help your practice grow. That's all it takes. I always wrap up with this. These are last year's numbers. Oops, let me bring that one back. If you're buying it because of the cutest shoes or the cutest little t-shirt, how good did that purchase make you feel at that moment? How good did that purchase make you feel when you opened the charge card statement? You ask any teenager who lives in the mall and buys all this stuff, how much of that they're wearing that they absolutely love. Because after you've washed that shirt a time or two, or after you've gotten blisters from those shoes, weren't so important after all. Most of us wear 20% of our wardrobe 80% of the time. If you don't need it, I mean, it's kind of what your parents told you when you were a kid. Don't buy it. And if you're a little older, it gets a little scarier. 8 personal credit cards. Now it's down to 6 because charge card companies are now canceling people out. Yeah, paying the minimum balance. 30 years to repay. You're not buying a house here, you're buying shoes and stuff that you have to dust later too. And you might not have enough for your own retirement. Forget the 401ks. Markets go up, markets go down. That'll be back. Depending on your age, might be okay. But don't dig a hole for yourself. Learned this one firsthand. My husband had hip surgery at the end of December. We closed the practice for 3 weeks. He came back and worked on just a couple patients. And it was a scary time. And I thought we were going to be okay. We were. We put it away. We were okay. Oh yeah, and then there's that whole medical co-payment that comes around. Make sure you put it away. Do you have payroll direct deposit? Everybody hear of payroll direct deposit? Okay. Smartest thing you can do, put a small portion in a passbook savings account. Right from your direct deposit, they can do it, even if it's just $10 a week. I say passbook savings instead of just a savings account because a passbook savings account requires you to go to the bank during business hours, take the little slip of paper, write down the amount that you want to take out, take it over to the teller, who then hands you your money. Now, if you wanted to go shopping at the mall and you had $260 worth of purchases that you wanted to make, and you could take it out of your passbook, you would have to leave the mall, drive to the bank, go through that process, and by the way, $260 at $10 a week is 6 months of putting away some savings account. Do you really think you're going to pull it out? How much easier it is to just pull out that piece of plastic, take that stuff home? If you save it, you're less likely to spend it. I'm a firm believer in every spouse needs their own money. In some homes, the wife controls the finances. In some homes, the husband controls the finances. Each spouse needs their own money. If you don't think it can happen to you, my brother died at age 57 from a heart attack. My sister-in-law did not have her own savings account. She could not access his charge cards because he was the principal. Ladies, you need just one credit card. Your name, his name. He needs one credit card, his name, your name. Both names, but a principal in each one. That's it. And you each need something of your own. We call it feeding the pig. When you were a little kid, you had a little piggy bank, and you got your allowance and you put it in. And then you wanted to go to the movies, and there wasn't enough. And your parents said, wait till next week. Or you did some extra chores around the house. Feed the pig. I love this. Zig Ziglar is one of the world's most well-renowned motivational speakers for his speeches, not necessarily for his name, but you help your patients get better care. You help your patients find a way to better health. You educate your patients on what their need is. You offer other services that you do. We didn't touch into that yet. We do cosmetics. We do gorgeous cosmetics. We've been doing composite dentistry since February 1981. Concise and adaptic. Yeah, that was interesting. How often do we ignore the patient who really would look better if we just image them and show them what they could do? We've started doing it in our office. We have one business assistant now, who'll just image anybody who wants to. We don't charge them. We just print it up on regular paper, mail it to them after their visit. Just thought you'd like to see, if someday you want to have something changed. Most people don't know this. Do you know from a length of half of a football field what the only recognizable feature is? Smile. It's the only recognizable feature. And for a lot of people, they'll take that home and stick it in a little drawer, and every now and then pull it out. You don't know what they're going to want to do next year. You don't know if Uncle Bill's going to pass away and leave him $10,000. You know what? I'm getting my teeth fixed. Innovate. What can you do differently than you did yesterday? And how can you make yourself indispensable? Talk to your patients as you would want someone to talk to you. Don't talk down to them. Don't talk up to them. Doctors talk doctor speak. You talk real world. It's going to take, don't worry. Some people actually cry. I didn't know I had periodontal. I've been going to the dentist for 6 months all the time. I moved here and now I came to you and my teeth are going to fall out. It's okay. You know what? That happens. Some offices just are a little different. We're very different. We're going to take care of it. It's going to take some visits. You're going to see our hygienist. You're going to see the doctor. We can get this under control with you. We're going to teach you some home care so that you can be doing better at home. Forget what happened. But when I was a kid, the dentist that I had was, it's okay, forget all that. That's old style. We're here to help you get healthy. Start with the master plan. Put your big rocks in first. Remember what I said? If you want to be the office that takes vacations together, family vacations, holidays, plan your calendar out a year in advance. I know how many doctors that I talk to that don't know until the month before whether they're going to come here or not, or any other good seminar. Plan it out. Work enough production days in each month to take off the time that you want. In my office, that means an average of 14 production days a month. But in July, with golf holidays, it's not a golf seminar, it's a golf holiday, and summer vacation, we work 12 days. I'm flanking it with 18 production day months either side. Your quarters have to end up the same. Reactivate patients. Nicest thing you can do is keep the people who are already there. So you can send reactivation letters. Remind them that fixing something small is the first step to fixing it faster and easier. Offer something. Send it in the mail. We haven't seen you in a while. We've missed you. We hope you're doing well. Enclosed is a brand new toothbrush, and please give us a call. We'd love to have you back. Most people don't even notice that it's been 2 years since they've been in. He's my dentist. Dr. Regiani fixed my tooth. You look it up 3 years ago. It's hard to respond, or harder not to respond, once they've accepted the gift. Did you ever get those little mailers? It's got a free stamp in it, it's got a nickel there, and it's got some picture of some sad-looking little child, and you just really feel obligated to send them $10. It's the same type of philosophy. In our world, we're humans. We are a give-and-take people. You give me something, I want to give you something. You give me a toothbrush, I want to give you my time. Just stick something in the mail with them. You can stick in magnets. This is my favorite little item. Didn't take it out yet. This is if you deal with Patterson Dental, and I'm sure other companies do it as well. Ladies, we need a mirror every now and then. But the other side is dental floss. I'm a flosser. I just love this. Oh yes, and the cute little case has our office name, phone number, and website. Chapstick, a cute little thing that you can hook onto something. Stick it in the mail. It's hard for them not to call you back. Celebrate silly days. This costs you nothing. We've been doing this now. This is going to be our second day. Have fun at work day. Put up streamers, do silly things. Tell your patient, oh my gosh, you're coming in on Monday, April 3rd. I'm calling to confirm you, and it's also have fun at work day, so just wait till you see us. See you Monday at 9. Caramel popcorn day. I love this one. Wouldn't that be a hoot? Your patients come in and there's a bowl of caramel corn. Didn't think we could eat that. Sure you can. You live in the real world. Don't gorge yourself, but take a handful. National Barbecue Month. If you've got a little area in your office where you could stick out a barbecue, wouldn't it be fun to invite your patients, hey, we're doing hot dogs, come on over. May 8th will cost you absolutely nothing. No socks day. Tell your patients, if they come in without socks on, they're going to be entered in a drawing for a pair of goofy socks. We're going to do women's, men's, and kids. Fun. And National Yo-Yo Day. Oriental traders. They're really cheap. You can get those little plastic little 1-inch yo-yos. Not for little kids. If you want to look up all the different days, there are Holiday Insights or Brownie Locks. They're my two favorite sites. Last year we heard about Have Fun at Work Day, and I thought there's got to be a way to find out what all kinds of days are. And there are many days that have multiple days on them. People ask me, what do I do? I love this. If you ever saw the movie Hitch, it's one of my favorite. At the end, Will Smith says, begin each day as if it were on purpose. How cool is that? Stuff will happen. But when you wake up in the morning and literally do this, it's amazing. When your brain hears your voice, your brain believes it. Wake up in the morning, stretch, and go, it is a great day, and my goal today is reactivate 2 more patients. It's funny, but when you say that, try this on a weekend. It's a great day. It's raining. It's miserable. It's a great day, and my goal today is to clean out that stupid little drawer in the kitchen. You know what? Before you go to sleep at night, you said it out loud. Your body is just going to keep taking you back to that silly little drawer in the kitchen that you've been waiting to clean out, the junk drawer. It works. I'm stuck. This is my one slide that sticks, and I don't know why. Just a little FYI, this is true. Apples are more efficient at keeping you awake in the morning. Be careful what you feed your own body. You can't be professing health to your patients if you're sitting there with a donut and a Pepsi. Think about that. And when you go to bed at night, be done with that day. It's over. It was one. Say aloud today, I am thankful for Kristen and Debbie, because today we succeeded in doing a great presentation and hopefully helping out a bunch of other people. Today I am thankful for Mrs. Smith, the sweetest little old lady that just referred 2 more patients to our practice. The amazing thing, and I don't know how religious any of you are or not, there are studies that have been done in hospitals. Groups prayed for patients that they never saw. Placebo group didn't get prayed, the other group did. You know, the crazy thing is, that group that was lifted up did better post-op. Why not do that for your patients? Why not just say, I'm thankful for Mrs. Smith. She just invited 2 more of her friends to come to our practice. So what do you do on Monday? You motivate, you communicate, you reduce the stress, and you innovate. All this information is available on the IAOMT website. If your doctors didn't give you that information, www.IAOMT.org under conference materials. I will take any question. All right, so thank you. I'll stick around for a couple minutes for question and answer, but our time is pretty much up. So I thank you for coming today.